So, Dr. Alan Marcus, welcome to our show.
Thank you, Scott. It's always good to be with you.
Dr. Marcus, you had a successful private practice for many, many years, and then you made the leap to the corporate world by becoming a medical director.
I'm the Chief Medical Officer, Director of Medical Affairs for Medtronic Diabetes.
So, why?
Well, I'd been involved with MiniMed since 1985 when the founder, Al Mann, asked me to come in as medical director and then a medical monitor and then medical advisor. And actually, I stepped out, but that was always in the course of while I had a full-time practice and taught as well at USC.
Kind of like extra credit.
Yeah, it was something because I don't really, my children are very upset when they have never developed a hobby. And so they say, Dad, you work all the time, and I say, this is my hobby.
Your hobby were your patients, I guess.
Yes.
So you had patients on the pump, and they were doing well, so you went into that.
Actually, that was correct. And originally I was recruited to be the medical director for the implantable insulin pump program. So from that course, I knew the company, I knew the people. And then about 3 years ago, I think the company reached a turning point and reached out to me and asked if I would come back and work. But my requirement for them was that I still see patients. And so actually 1 or 2 days a week I'm still in my practice and I still see patients. Only now it's actually a lot easier because now my patients have my cell phone, so I don't have to go through a beeper service, and that's become a lot nicer. And your patients are your family. I mean, you're cheering their successes and you really are distraught with failures. And you share their happiness and their sadness. And I would never, ever, ever leave clinical practice because that's what made me want to become a doctor. That's where the contribution that you make in medicine is. You know, I think that I need to offer more patients the ability to interact with their physicians in a meaningful manner, and that's what I hope I'm doing at Medtronic. But for myself, you know, I'm going to continue what I feel is a successful contribution to making my life have meaning on this planet.
I'm impressed. Dr. Marcus, people listening would go, I want you for a doctor. Your practice is full, I would imagine.
Well, you know, I still do see new patients, and you know that's very kind of them to want to come see me. And you know, I'm always honored and flattered that people put their lives and their trust and their education and their ability to move forward and safely in their life in my hands.
So if people look you up in Orange County, they could get an appointment?
Yes. So especially if they mention Scott King. Then we'll make sure of it.
And then you mentioned you'd love to roll out this kind of patient care to doctors and patients. How are you doing that? Through your work with MiniMed, Medtronic?
And that's exactly right. The way to make a patient more involved and more activated is by giving them more information. You know, what made the patient passive? When the physician says, you're fine, goodbye, and no information. I mean, you mentioned, you know, having your patient check their blood sugar after meal and write down what they ate. Well, right away, now they're beginning to see, okay, there's a relationship between what I eat and what my blood sugar is and what my medicine. And basically, after you train and teach and share your knowledge, they can do that. And what we're doing at Medtronic Diabetes with sensor augmented pump is exactly that. We're giving them information on their glucose, moment by moment, real time. We're training them each week how to download their week-long patterns, how that fits into the same thing that we used to do that I did years ago, which is teaching them how to check their overnight, how to check their before meal to their after meal, breakfast, lunch, dinner, each of their snacks, how their insulin to carbs, how their insulin's working, and then to look at that and to say, oh, well, I'm out of target here, I'm in target here, I'm out of target here, and we're leading them to be able to interpret that and make the suggested changes. So when they meet with their physician, they have all the information, they have all the activities that cause that information, and they have the suggested remedy for it. So that interaction now becomes not one where you do things that are meaningless, but you actually are forced between the physician and the patient to move in a direction that solves the problems that exist.
That's brilliant. I just got the tie down that you seeing one patient at a time, teaching them to write down their after meal. Now you've got a machine that will do that. And now you need to train the the diabetes community, how do you go into your doctor and create this relationship that you've already had with your patients through the old-fashioned method?
It's correct. I mean, I didn't seem to be able to get individual physicians and patients to be as methodical on their postprandials and their meals and their change, and there was enough debate about it, and resistance. But with technology, you can gain much more information, but it's the same basic foundation. The foundation is, what are you doing, what did it cause, and how do you fix it? And, it takes two people to look at it and to come up with a solution. But sometimes, after you receive enough training and education, then your follow-ups are basically, am I doing the right thing? Are my corrections correct? How are my lipids? How's my blood pressure? Do I need other medication? My eyes, my feet, and my nerve function? But the goal is the same as it's ever been, to look at the day-to-day and week-to-week management of glucose, which is a very tough thing. Very erratic sometimes not so erratic, but always necessary to know and to react to.
So doctors can contact you at MiniMed, and you have education programs?
Yes, in Medtronic Diabetes, which is actually the new corporate name for Medtronic MiniMed.
Okay.
And they can contact me there, and we have a full medical education department that is available with training material on sensor-augmented pump, on CareLink.
For healthcare professionals?
For healthcare professionals on CareLink, as well as for patients. And CareLink is basically that system that collects the information as to, what you ate, what your glucose was, what your insulin was, how they reacted, and not just by single dots now, but by looking at a living waveform of glucose that passes through your body.
And this new meter, is it not available in California yet? How does someone get it?
Okay, the Paradigm Real-Time is available anywhere in the United States. It's available in Europe and Canada and in Asia Pacific now. It was approved by the FDA, and all you have to do if you have a MiniMed or Medtronic pump, which is out of warranty, which is within warranty, you can upgrade. If it's out of warranty, I think there's a special program. If you need this technology and would benefit from it, and your physician feels so, then they write a prescription. It's a prescription item. Insurance approval is sought, and then you're trained both on the pump and then on the sensor. And the sensor actually is an added cost. It comes with 10 sensors, which is a full month's worth of sensing. And within that month time, most of our patients in our studies that we've done are effective in being able to learn all that they need to interpret the downloads, that looking at the after meal, the meal, and the overnight periods in anywhere from a 2 to a 6 week period.
So you have to get the pump, have to get the sensor?
Have to get the pump in order to get the sensor.
Well, what about for us basal bolus guys that want the sensor so we can see how many units to take with our insulin pen?
Well, we do have a sensor that works without the pump, and actually that's called the Guardian Real-Time, and that is also going to be available. Right now it's Guardian RT. That'll be replaced with Guardian Real-Time in a short period of time, but Guardian RT will tell you your individual glucose every 5 minutes and is downloadable. And that will also enable you to see your glucose on a continuing basis. If you purchase Guardian RT now, then you can upgrade that to Guardian Real-Time, which will be look more like a pump, for instance, with having waveforms that are displayed on the pump as well as trend arrows that tell you that you have moved or you've been going too high or too low, too fast. Both of the technologies, all three of them, have alerts that you can set that will signal you when you're going too high or too low. Now, those alerts should not be, confused with targets, because the alerts actually are your wide safety net. We always tell people, if I can give a basic rule of thumb with learning how to use these technologies, it's like driving. It slowly adds to your knowledge base the more you drive. So when you first started out driving, you didn't go on the freeway, you didn't go on the Formula One course.
Right.
It was a parking lot in the middle of a Sunday and there were no cars. So you set very wide targets that are safe. Learn what the sensor and technology is telling you. Then slowly over time, as you become more confident, you make the changes. It's obvious that you ate the wrong thing for breakfast, your insulin was misdosed or mistimed. As you make those changes, then begin to lower your targets. we're recommending an 80 milligram per deciliter for low and a 240 milligram per deciliter for high. If you're a pediatric patient, for instance, and you have an A1C of 6.8, you spend 25% of your day above 200. We spoke about this a long time ago, that it seems like a sin because you only need to get 49% of all your blood sugars between 80 and 180 to have an A1C of 7%. And we can't fill that bucket with 49% of a day's blood sugars. So this is a technology that will hopefully not only allow us to fill it with 49%, but in the 50% at least.
You're getting me excited. As a Kaiser patient, are insurance companies purchasing the meter yet?
Yes, and we've been very active over the past year, traveling throughout the country, meeting with all the insurance companies for about a year and a half now, explaining to them what the technology is, when it'll be available, so that it wasn't that, oh, look, we have this new thing. We were trying to explain exactly the methodology by which it worked and the benefit that it would come to the patient. And therefore, when we released it, they actually were not surprised. There's no difference in approval for the pump. For the sensor right now, we don't have insurance approval except by Medtronic insurance. All Medtronic employees are actually covered for sensor, which I think is a very nice thing of the company to have done.
It's a good reason to get a job there.
I think it's a great reason to come to work for Medtronic. But the Medtronic mission is actually to do things that are good for people, to restore health, to prolong life, and to alleviate suffering. And that's part of what they do for their own employees, and that's hopefully what, they're an extension of everything that we all wanted to do as individuals.
Alan, thank you so much for coming down, and thanks for all that you're doing for people with diabetes.
Scott, thank you. You know more than anybody else how much of a partnership taking care of people with diabetes is. And Scott, I still remember walking down the streets in New Orleans when we both wondered if we would ever see a tomorrow where the sun would rise every day, meaning that we would be really happy about the state of the affairs of diabetes. It's only come because of you and everyone else that you've enlisted in this cause. And this is better than a children's crusade. This is a noble crusade. Thank you, Scott.
Thank you, Alan.
Thank you.